Welcome to the updated Dr. Bernstein podcast. Please check the description for the original sources. And all content is general in nature and should not be considered medical advice. When it comes to diabetes, we often hear about the importance of blood sugar control. But what about the feet? Today, we're doing a deep dive into diabetic foot care, comparing Dr. Bernstein's advice with current PubMed research.
Yeah, it's an area where, those minor issues can become life-altering. Dr. Bernstein doesn't shy away from the seriousness of this. He cites a 10% amputation rate for diabetics, and the research backs him up on that. A 2022 diabetes care study looking at participants from the Diabetes Control and Complications trial confirmed these high rates of lower limb amputations.
10%. That's a scary number.
Yeah.
It really highlights why we need to take this seriously. And Dr. Bernstein's main message is that keeping your blood sugar in a normal range is the foundation for preventing these complications.
Yeah, he's absolutely right to emphasize that. Think about it. High blood sugar doesn't just affect your overall health. It directly impacts your feet. It leads to changes that make them incredibly vulnerable. For example, peripheral sensory neuropathy. You might not even feel a cut or a blister.
Ouch. I can see how that would be a problem. You wouldn't know to treat the injury, and it could get much worse.
Yeah.
Dr. Bernstein also mentioned something called sympathetic neuropathy, right? What exactly does that do to the feet?
So sympathetic neuropathy reduces sweating, so your skin gets really dry and prone to cracking. That's basically an open invitation for infection. And then there's impaired circulation,
Yeah.
which slows down wound healing and increases the risk of those infections becoming really serious.
So basically, high blood sugar creates a perfect storm for foot problems. Like every little nick or scratch becomes a potential disaster. And speaking of turning minor issues into major ones, Dr. Bernstein has a really strong opinion about calluses, doesn't he?
He does. This is where his experience really comes into play. He claims that the most common trigger for amputation isn't something exotic or complex, but attempts to remove calluses.
Wait, really? I always thought calluses were just a bit of hard skin. How could they be so dangerous?
It seems counterintuitive, right? But Dr. Bernstein, based on 30 years of working with wounds, believes the pressure used to remove a callus can actually disrupt healing. This creates a pathway for infection. And when you combine that with the other foot issues diabetes can cause, well, it can be a recipe for disaster.
That's mind-blowing. I'm going to think twice before letting anyone touch my calluses now.
Yeah.
It makes you wonder what Dr. Bernstein recommends instead of removal.
Yeah.
Especially since he's so against it.
His advice is actually quite simple. If you can, don't remove calluses at all. And if they're really bothering you, try to manage the pressure that's causing them. He suggests things like wider shoes or custom orthotics to redistribute that pressure away from the callus-prone spots.
So it's all about prevention and managing pressure. That makes sense. And it's interesting to see that some of the PubMed research, while not specifically about callus removal, does highlight foot deformities as a risk factor for ulcers and amputations.
Exactly. Foot deformities often lead to those pressure points that Dr. Bernstein warns about. So even though the research doesn't explicitly address callus removal, it does support his focus on pressure management.
Okay, so far we've learned that diabetic foot care is much more serious than many of us might have realized. We've got these high amputation rates, the impact of high blood sugar, and this whole callus conundrum. What else does Dr. Bernstein emphasize in his podcast?
Well, he spends a lot of time talking about footwear, which is something we can all relate to, right?
Oh, absolutely. Shoes are important for everyone, but especially for people with diabetes. What does Dr. Bernstein have to say about choosing the right shoes?
He goes beyond the usual comfortable shoes advice and, gets pretty specific. He's adamant about ditching those pointed-toe shoes they're practically designed to create pressure points.
Oh, yeah. I can see how cramming your toes into a pointy shape would be bad news. So, what does he recommend instead?
He's all about shoes with a deep and wide toe box. Plenty of room for your toes to wiggle. This is especially important if you have hammer toes.
Hammer toes, I've heard of those, but can't quite picture them.
Imagine your toes being permanently bent at the middle joint, kind of like a claw. It makes wearing certain shoes really uncomfortable and increases the risk of pressure sores. Dr. Bernstein points out that hammer toes are pretty common in people with diabetes, so it's something to keep in mind when you're shoe shopping.
Okay, I'm definitely going to check for that extra toe room from now on. Dr. Bernstein also talks about pink spots on the feet, right? What are those a sign of?
He says those pink spots are like little warning flags. They're a sign of pressure, and if you ignore them, they can turn into calluses, ulcers, and even worse. His advice is to modify your shoes to get rid of whatever's causing that pressure.
So it's about being proactive. Don't just wait for things to get bad. Do the PubMed articles offer any insights into how to actually modify shoes for pressure relief?
While the articles don't go into DIY shoe modifications, they do strongly emphasize proper fit. Several studies point out the link between foot deformities often made worse by ill-fitting shoes and the risk of ulcers and amputations. It really underscores Dr. Bernstein's point about pressure being the enemy.
It seems like so much of this comes down to pressure, avoiding it, managing it, making sure our shoes aren't contributing to the problem. Speaking of which, does Dr. Bernstein offer any tips for checking if your shoes actually fit well?
He does. He has a simple technique you can use to make sure there's enough room in the toe box. Stand up with your shoes on and feel for the space between your longest toe and the end of the shoe. There should be at least half an inch, ideally more.
That's a great tip. I'm going to try that right now.
Yeah.
It makes you wonder how many of us are walking around in shoes that are actually too small.
It's definitely something to be aware of. And speaking of being aware, Dr. Bernstein is a big advocate of something he calls daily foot inspection. It's just what it sounds like, checking your feet every day.
Okay, that seems straightforward enough. But is there a right way to do it? Is it more than just a quick glance?
There's definitely a method to it. Dr. Bernstein stresses visually checking for any cuts, blisters, redness, swelling, anything that looks out of the ordinary. But because neuropathy can mean you don't feel pain, he also says you need to use your hands. Feel all over your feet for temperature changes, bumps, or tender areas.
So it's a full sensory experience, sight and touch working together, and daily, because as we've learned, things can change fast with diabetic feet.
Exactly. Early detection is key. Even a tiny cut can become a major issue if it doesn't heal properly. Dr. Bernstein even suggests using a mirror to see the bottoms of your feet if you can't bend over easily.
That's smart. He also mentions toenail care, right? Is there a specific way people with diabetes should be trimming their toenails?
Dr. Bernstein is actually quite cautious about that. If you have neuropathy or vision problems, he strongly recommends getting your toenails trimmed by a professional, like a podiatrist. He says it's just too risky to do it yourself if you can't see or feel properly.
Makes sense. Wouldn't want a simple toenail trim to turn into a big problem.
Hmm.
So we've got footwear daily inspection and even toenail care. What other insights does Dr. Bernstein offer on foot care?
He spends a good amount of time on dry skin, which, as you know, is a common side effect of diabetes.
Right, that sympathetic neuropathy we talked about, it reduces sweating and makes your skin dry and crackly.
Exactly. And dry, cracked skin is vulnerable to all sorts of problems.
Yeah.
So Dr. Bernstein really emphasizes keeping the skin moisturized to prevent those cracks. And get this, his go-to moisturizer isn't some fancy lotion, it's olive oil.
Olive oil? For your feet? That's kind of surprising.
It might seem a little unusual, but he swears by it. He finds olive oil to be super effective at moisturizing dry diabetic feet. In fact, he prefers it over lotions, which he claims don't absorb as well.
So ditch the expensive lotions and head to the kitchen pantry. Simple, affordable, and apparently very effective. Does he say how often to apply the olive oil?
He suggests applying it daily, or even more often if your skin is really dry. And here's a tip. Put it on after you shower or bathe while your skin is still damp. This helps lock in the moisture.
Okay, so it's like a daily ritual inspect, moisturize, repeat. Sounds like a pretty good habit to get into. It's really striking how Dr. Bernstein explains not just what to do, but also why it's important. It makes his advice so much more impactful.
I agree. It's not just about following a set of rules, it's about understanding the reasons behind them. It empowers you to take control of your foot health. And it's this combination of practical tips and medical explanations that makes his approach so compelling. But remember, while Dr. Bernstein's experience and observations are valuable, it's important to remember that his views, especially on callus removal, are not universally accepted in the medical community.
That's a really important point. You're right, we need to be careful about taking any one person's advice as gospel, even if they have a lot of experience.
Exactly. It's always best to seek multiple perspectives and consult with your healthcare provider. They can help you weigh the risks and benefits of different approaches based on your individual situation.
That's great advice. So we've covered a lot of ground here. The dangers of pressure, the importance of proper footwear daily inspection, even moisturizing with olive oil. But before we move on to the final part of our deep dive, I'm curious what other alternative foot care practices might be out there.
Yeah, that's a great question to consider. It highlights that we've only scratched the surface here. Even with Dr. Bernstein's insights and the PubMed research, there's always more to learn about taking care of your feet, especially with diabetes.
You're absolutely right. This deep dive has been a real wake-up call for me. I never realized how much goes into proper foot care, or how much is at stake.
Yeah, it really underscores the importance of being proactive and making informed decisions. You know your feet are literally carrying you through life, so they deserve some extra attention.
I couldn't agree more. So where do we go from here? We've learned about these alarming amputation statistics, the dangers of calluses, the need for proper footwear, and even the benefits of olive oil. What can listeners do to put all this knowledge into action?
Well, first and foremost, talk to your doctor. They can assess your individual risk factors and help you develop a personalized foot care plan.
That's such an important reminder. It's easy to get caught up in general advice, but everyone's situation is different.
Exactly. And remember, diabetic foot care isn't a one-time thing. It's an ongoing commitment. Make those daily inspections a habit. Pay attention to how your shoes fit and moisturize regularly.
It's all about integrating foot care into your daily routine and your overall diabetes management plan. Small, consistent actions can make a world of difference.
Absolutely. And don't be afraid to ask questions. If you're unsure about something, reach out to your healthcare provider or a diabetes educator. They're there to support you.
This deep dive has been packed with information, and I hope it's empowered our listeners to take better care of their feet. We've covered so much. But if there's one key takeaway, it's that diabetic foot care is not something to take lightly.
Right. It's about prevention, early detection, and being an active participant in your own health journey.
Well said. And remember, it's never too late to start making positive changes. Even if you've been neglecting your feet in the past, you can turn things around today.
Every step you take towards better foot health is a step towards a healthier and happier you.
That's a great note to end on. Thanks for joining us for this deep dive into diabetic foot care.
It's been a pleasure.
Remember to like and subscribe. And thank you for listening.